from Alergan. Look for the holographic film on the vial label. Do not use the product and contact Alergan as soon as possible if the rainbow lines or the name Alergan do not appear, or the tamper-evident seal is not intact and present on both ends of the carton, or the translucent silver Alergan logo on the seal is not clearly visible, or has a black circle with a diagonal line through it. Check the contents of the vial. Although it may appear to be empty, it contains a small amount of vacuum-dried Botox. Botox must be reconstituted with sterile 0.9% preservative-free sodium chloride solution prior to use. The reconstitution technique shown here is for a 100-unit vial. Please consult your local summary of product characteristics if using another unit vial. Botox must be stored in a refrigerator at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. For reconstitution, you will need gloves, an alcohol swab for reconstitution, sterile 0.9% preservative-free sodium chloride solution, the refrigerated Botox vial, syringe and needle for reconstitution, a 1 milliliter syringe and needle for injection, an alcohol swab for injection, gauze, dilute sodium hypochlorite solution at 0.5%. Always consult your local prescribing information before reconstitution and ensure you have familiarized yourself with all the steps required for injection preparation. Botox 100 units requires 2.5 milliliters of the sodium chloride solution for reconstitution. Asepsis must be maintained throughout reconstitution, dilution, and injection. Before starting, use an alcohol swab to clean the stopper of the sodium chloride. You are now ready to extract the recommended volume. Ensure the solution is steady while inserting the needle. Adding 2.5 milliliters of sodium chloride solution will give a dose of 4 units per 0.1 milliliter. Draw up the correct volume of solution and insert the syringe and needle into the center of the rubber stopper on the Botox vial and allow the vacuum to pull the solution into the vial. The needle tip can be aimed towards the wall of the vial to help prevent bubbles from forming when the vacuum is released. The presence of the vacuum demonstrates that the Botox vial is sterile. Therefore, do not use the Botox if there is no vacuum to pull all of the sodium chloride solution into the vial. Remove the syringe. Gently rotate the vial to help prevent bubbles from forming. Do not shake or invert the vial. Now reconstituted, the solution must be visually inspected prior to use. Only clear, colorless to slightly yellow solution without particles should be used. Discard if in doubt. Attach a new, sterile 1 milliliter injection syringe to the mounted reconstitution needle. Tilt the vial and place the bevel of the needle against the side to help all the Botox product to be drawn up. Do not completely invert the vial. Draw up 0.5 milliliters for glabella lines, 0.5 milliliters for forehead lines, 0.6 milliliters for crow's feet lines. Detach the filled syringe and reconstitution needle from the vial. Gently tap the syringe to expel any air bubbles from the liquid to ensure patients receive an accurate dose of Botox. Disconnect the syringe from the reconstitution needle and attach the needle for injection, usually 30 gauge. It is mandatory that the reconstituted Botox is only used on one single patient during a single treatment session. You are now ready to inject the recommended dose of Botox. 20 units for glabella lines, 20 units for forehead lines, 24 units for crow's feet lines. Any opened reconstituted Botox must be used within 24 hours as the product and diluent do not contain a preservative. During this time, Botox must be stored in a refrigerator at 2 degrees to 8 degrees Celsius. Unopened Botox vials have a shelf life of 3 years. Immediately after use and prior to disposal, any unused reconstituted Botox solution in the vial and or syringe must be inactivated with dilute sodium hypochlorite solution at 0.5%. Used vials, syringes and materials should not be emptied and must be discarded into appropriate containers and disposed of as medical biohazardous waste in accordance with local requirements.